I was a young attending. I'd been out for a couple of years, and in the hospital where I was in, they wanted to start a more invasive vascular surgery program. And so the vascular surgeons were going to start doing thoracic aneurysms, thoracic aortic aneurysm repairs, which is, in terms of level of complexity, there basically isn't much more complex kind of surgery you can do. I mean, cardiac surgery is similar, but it means you're splitting open a person's chest and you got to cross-clamp their aorta and kind of fix this aneurysm. And in today's world, now many years later, decades later, the vast majority of those patients are put on partial cardiopulmonary bypass. It's difficult to do the operations, many of them without cardiopulmonary bypass of some sort. And we went ahead and did this with the vascular surgeon, who, when he cross-clamped the aorta, was not that quick, and he took a long time to do the surgery. So when you took the cross-clamp off, now the repair was done, the lack of blood flow to the lower half of his body led his blood to not coagulate properly, and he essentially just started to ooze blood from every pore you can imagine, out of his ears, out of his eyes. And my job as the anesthesiologist was to fix this problem. Now, I'm not sure I would have been able to fix it regardless. It was an ill-prepared operation. But the challenge is that, even to this day as I think about it, I don't know whether he would have survived. But if I'd thought about it early enough and gotten the right blood products from the blood bank, they would have been ready and available for me to use. And I didn't think of it quickly enough. And some of the stuff from blood bank needs to be thawed. That's frozen, so you got a 30-minute delay. And I was standing in the operating room looking at this patient who was literally weeping himself to death, and I had no way of getting the blood products into him. I mean, you want to talk about a picture that never leaves, ever leaves. If I think about it in retrospect now, communication, teamwork, planning, discussion, checklists, system reliability, all the things that we talk about in patient safety could have come to bear, and a couple of things might have happened. One is that group of vascular surgeons might not have chosen to do that operation. There may have been more forethought with the cardiac surgeons and the perfusionists about bypass beforehand. If they had decided to move ahead, there would have been more planning on my part, a little more forethought. Maybe I would have had checklists. In those days, there weren't checklists and relationships between blood bank and the operating room for massive transfusion protocols. So if we'd had those in place, they would have been able to get me blood faster, and then I might have had a slightly better chance. I mean, there's so many things that could be different.
It was this past semester. I was on one of the floors at the hospital, and we were just starting to give out medications, and obviously I had a clinical instructor with me. And at the hospital, they put all of the orders for the patient in the computerized system. And I think, unfortunately, it's a little sort of convoluted. They keep every order in there from beginning to end, current ones, active ones, and discontinued ones. So the laundry list can be quite huge. And it was almost a potential medication error. And a lot of the patients, unfortunately, are quite ill, and they're on 15, 20 medications, sometimes more. And I was gathering them all out. We had laid them all out. And the instructor was asking me one by one, why are we giving this one? Just kind of giving the reasoning, so I knew what the medications were for. Then we finally got to one of them. She's like, and why are we giving this one out? And I wasn't supposed to be giving that out. It wasn't a major problem. It was supposed to be given later in the afternoon. I thought it was, everything was like listed AM, PM, or evening, and I missed that. And it wasn't anything major. It was sort of an antacid drug that wasn't supposed to be given with, I think, an iron tablet the patient was taking earlier in the morning. They just should be given further apart. But just the fact that when the instructor pointed it out very matter-of-factly, and she was great about it, it just sort of made you feel a little ill almost, that, oh my gosh, I didn't read that right. What if it were something, a little more, important or potentially harmful than just sort of an antacid medication? So it just sort of, really, there are 2 other checks before we would have actually administered it, so hopefully I would have caught it on my own before that happened. But, it just was kind of sort of scary and eye-opening to see that, you can just read things so quickly and you just, act before, you maybe think sometimes. But hopefully, again, I would have caught it.
Like everybody in healthcare, I've made mistakes, including big ones. I'm not proud of them, and I'm not proud of the way I dealt with them. As a young physician in training, as a resident, one night on duty, I made a serious error in a blood transfusion on a tiny baby. The equipment that I was provided for that transfusion was different from the equipment in the intensive care unit in which I had been trained. Luckily, the baby survived. I called for help. I had the fellow come in to rescue me and the baby from that terrible error. My feelings at the time were almost all guilt. I cried after the event and felt that something was deeply wrong with me that I would commit such a serious error. The fellow who came in was nurturant. He encouraged me. He told me it could have happened to anyone, although I didn't believe him. And I then went through the next week or two as a bit of a zombie as we hoped that that baby would survive. What I now know about that event is that it was a system issue. I was trained wrong for that setting, prepared to administer a blood transfusion with different equipment from the equipment I had. I really do believe now that almost anyone in that situation stood a substantial risk of making that same error. What I didn't do at the time was reveal that I had made the error openly with my colleagues and the people in that hospital so they could have made a change in that system if they chose to. I felt too guilty to do that, and the error became a secret. Now what I know is that that's wrong. Somehow from my own will, or perhaps even more realistically from the behaviors and attitudes of the leaders of that system, what would have been better is if I had had the confidence and the support to come forward with the story of that serious problem so that the system could learn from it and changes could be made to protect future physicians and nurses from the same kind of error. Nowadays, I hope that healthcare is maturing into a better kind of system for a worker like me, frail, error-prone, human. And I guess what I've learned today is that unless we build systems around people like me to support us through hazards like I experienced, the system won't get safer.